Over the last 12 months, there has been ongoing debates regarding the agreement of joint cleaning audit scores within the trusts. To this end, a small group comprising representatives from Mighty and RCHT was established to try and resolve this issue. The group devised two work streams, one focusing on the process for joint auditing of cleanliness of the environment, and one focusing on a process whereby ward-based equipment would be clean and evidence available to support that this had been done. Instrumental to the success of Workstream 1 were Rob Naventa and Dave Finn of Mighty. They devised the new process and worked with the Mighty team and the ward team to ensure a full understanding of how the process should work. Instrumental to the success of Workstream 2 was Diane Poppleton, Healthcare Assistant on Carnkai Ward. Diane has worked relentlessly to galvanise the ward team and ensure the success of the project. Without Rob, Dave and Diane, this project would not have been a success, and we would be failing with our requirements to ensure that our hospital is clean.
I am nominating the Clinical Site Management team for their outstanding effort and contribution towards maintaining patient flow and ensuring a safe and effective environment for patients and fellow work colleagues. The team work in partnership with all departments and various teams of people across the whole trust to ensure patients have the best source of care at the right time in the right place. The team deal with many complex situations and issues at once and never falter at trying to ensure patient safety 7 days a week, 24 hours a day. The team have many talents, dedication, loyalty and a can-do attitude. I have worked across various organisations over the past 25 years within the NHS, and I have found that this team to be the most resilient and capable and pleasure to work with. I would be absolutely delighted if their talents were recognised by the organisation.
Our nominees, Jane and Becky, have been chosen for their outstanding and consistent contribution to the provision of anaesthetic services across the Trust. Their professionalism, resilience and positive outlook have made them much loved members of the anaesthetic department, and they are an indispensable part of the anaesthetic team. Administration of the anaesthetic rota has become an increasingly challenging part of Jane and Becky's daily workload, not least because of the introduction of a new computerised anaesthetic rota. The long-term gain of this electronic system is indisputable, but the short-term pain to those involved in its implementation has been immense. Our department is large and busy, and we don't regularly get to see our colleagues. The various uplifting events organised by Becky and Jane have really lifted spirits and brought us together. We owe Jane and Becky at least a one and all award. They are great colleagues, lovely individuals and completely indispensable members of our anaesthetic department. Thank you, ladies.
The Heart Function Specialist Nursing Team is a passionate team of two nurse specialists who care deeply about their patients. They work closely with their community peers in caring for a group of patients with heart failure. Whilst working with their patients, it was highlighted that we could improve promotion of the concept of patient self-management whilst providing them with additional information regarding their condition. Through working with patients, their community colleagues and their senior nurse, a heart failure self-management plan was developed. This prompts patients with key actions to complete in response to their symptoms. The results are that patients utilising this self-management plan escalate problems quickly to their relevant healthcare professional to avoid their condition deteriorating to avoid acute admission to hospital. All those involved in this project have been positive, and patients find it useful as it has empowered them to manage their own condition.